Hey there, I'm Siddhartham and welcome along to the Gradlife, the podcast where we delve into the minds of the folks who've been there and done that in grad school and really get to know what it took them to get to where they are today. On today's chat, you are going to be listening to my wonderful co host, Salva. Shout out to Salva. Um, you can listen to her talk to somebody who I think pretty much epitomizes having been there and done that. She has a bachelor's in pharmaceutical sciences, a master's in medicinal chemistry. Then she went on to get a PhD, and then she's been involved in patents, clinical trials, dissertation awards, you name it, she's done it. She has been there and done that. Now, interestingly enough, when I was a new student on campus at the University of Cincinnati as a graduate student, I had heard of Nimita's name, but never really had a chance to meet her or to talk to her. So I'm very curious to know about her journey, about her experience. So I am excited as anybody else is listening to this right now. So without further ado, let's listen to what she has to say.
Well, hello everyone. Welcome to the Gradlife podcast, where we interview folks who have been there and done that in grad school to share their journey and inspirational stories. I'm your host, Salwa Arafa, and on today's episode, I chat with another very distinguished UC alumni and a very dear friend of mine. Despite the hardships she's been through, she is always had/have a positive outlook, and she's madly in love with life. That's why I love her, and that's why I brought her on the show today. A little background about her: she holds a PhD in pharmaceutical sciences from UC. She is now a director and the head of clinical pharmacology at Black Diamond Therapeutics, and she has published about 15 papers in prestigious peer-reviewed journals, and she's also the vice chair of pharmacokinetics, pharmacodynamics, and drug metabolism community at the American Association of Pharmaceutical Sciences, and much, much more. You should have seen the bio that she sent me. She has done amazing things in a very short period of time, and I'm so very proud of her, and I'm so excited to bring her today on the show. So without further delay, Mike is on Nimita. Dave, hey Nimita, how's it going?
Hello. Good. How
I
have you been? So glad to be here. Thanks for inviting me.
Yeah, for sure. Long time no see. We just did a trip to Montana together. It was nice. I We haven't seen each other in what, like 2 years or so.
Uh, 2 weeks?
Yeah, but like the Montana trip was the
Ye-
first time we got together in like over two
Yes.
years. Life is
Yeah, over
crazy.
2 years. I know.
So where are you located now? Like I know where you are, but where are you now? So the
So
audience
I
know.
I I I live in Boston area.
Mm-hmm.
Black Diamond Therapeutics, where I work, is based in Cambridge.
Okay.
It's part of this what's known as the most innovative square mile area
Mm-hmm.
between Central Square and Kendall Square in Cambridge.
Gotcha. So first question I'm going to ask you, and I ask most of the audience, and I feel embarrassed because I'm your friend and I really don't know much about your hometown. So if you can if you can tell the listeners a little bit about like your hometown, like how different is that from the US? I know that you lived in a lot of major cities in the US. So where are you from in India, and how different is that from the US?
Well, yeah, definitely. So I grew up in Bombay. That's what we used to call Bombay when we grew up, but now what is known as Mumbai in
Mm-hmm.
India, and which is like a big city like your Manhattan, New York City.
Mm-hmm.
So I did grow up in the heart of the city, very close to the sea, ocean, and very close to the Indian Stock Exchange and all that. So in the major part of the city. But so basically, I do have something about living in the city. I love all the craziness going around, walking over to place cafes and restaurants, and I love using public transport. So I'm in my super comfort zone here in Boston with that.
Right. I was gonna
And that's
say.
the other reason I love Chicago too. And there was
Mhm.
one thing that was definitely missing in my years in Cincinnati and
Yeah.
also in Indianapolis after that. Yeah.
Gotcha. Okay. That's so awesome. Like I didn't know that your hometown was actually like a big city. I'm from a city too.
Mhm.
Alexandria, Egypt. And when I moved to Ohio, Cincinnati, Ohio for school, where we met, I had a hard time adjusting just because I was used to the, like the loudness of the city, and like Cincinnati is so quiet, and like I couldn't sleep at night because I was used, to like cars in the street.
Yeah.
So I totally get it, and I'm glad you're where where you're supposed to be, or your comfort zone. So that's awesome. So let's talk about a little bit like grad school flashbacks. So what made you want to join grad school? And I know that your degree, I said pharmaceutical sciences, but it's you were majoring in pharmacokinetics, correct?
Mm-hmm. Yes.
So why pharmacokinetics?
So there's a long story to that. First, when I did my bachelor's in pharmaceutical sciences in India, and the subject I fell in love at that time was organic and medicinal chemistry.
Mm-hmm.
So when I came to the US, I always knew I was going to come study, uh, like go to grad school, because I come from a family which was not very common from for where I come from, but I'm super fortunate to be from a family where it's full of PhDs and doctors, MDs. So it was kind of totally taken for granted that whatever field I take, I have to go to
Yeah.
the highest degree. So there was no question or no discussion about it. It was just assumed. So I always knew I was going to go to grad school. Plus, my dad studied in the U.S. and back in 70s.
Mm-hmm.
He had this, these pictures with bell bottoms and long side locks, and in his Beetle convertible. So that's why Beetle is my favorite
Yeah.
car. You
Oh
remember
wow,
I
now
bought
I
it when I
know.
graduated. So that's where it comes from. So I always was trying to go. So actually, I was getting into a med school after my high school in India. But I didn't go in because my dad was like, if you do pharmaceutical sciences, it's easier to go to US. So I
Mhm.
picked pharmaceutical sciences over that so that I could come here. And I did my master's in medicinal chemistry, and then I actually started my PhD. But then life happened. I got married to my ex-husband, and I had to move with him to Ohio. So I left that, and then I started working for a small company, and then I applied at UC for PhD again. And at that time, my first preference was still chemistry, and then second option I'd put in my mentor's Dr. Desai's name from
Mhm.
looking at the division. But the coordinator, Marcy Silver, that time, she reached out to me and said, we don't have any opening in MedChem. And do you want to talk to Dr. Desai about this? I'm like, sure. So, one thing about me has been, yes, I plan a lot for my plan A's, but
Mhm.
my life has never been about plan A. It never works. It
And
just
that
works.
actually worked perfect for you. That's one thing like we emphasize in every episode, that most people like they are where they are now because they kept an open mind, being
Yes.
really flexible.
So
Yeah.
yeah, and exactly. That's my whole main thing, that keep an open mind as a student,
Mhm.
graduate. Like, you don't be so fixated to it's best to try for your plan A, but it if it works out, great. If it doesn't, not. But I feel it was a blessing in disguise because I love pharmacokinetics, pharmacodynamics.
Mhm.
You bring in all of it together, biology, chemistry, mathematics, which also I love. So it just worked out to be like the perfect combination for me.
Awesome. That's an awesome like background that also like has details that being your friend I did not know about. So all right. So after completing your degree, I know your history. So you started as a postdoc and then you switched to industry. You've been with AbbVie and then Blueprint and now Black Diamond. So you did a little bit of everything. You're also an adjunct, right? So you teach for UC
Hmm.
online. Would Can we say that Nimita has landed her dream job? Like any of these jobs have been a dream job, or where you are right now is this is it for you, or what would you
Uh,
say?
yeah, I wouldn't call it like landed my dream job. It's all, I just see that I'm just carving still my path to that ideal place where I want to
Mm-hmm.
be. Because I eventually, like initially, when I got into my PhD program, the
Mm-hmm.
one thing that I always thought I would want to do is be a professor. So that was my goal. So I always used to take up teaching courses. I also did preparing future faculty certification at UC. And I always, even as a postdoc, I took up the opportunity to teach PharmD students and master students. And that's what, like, then I went on to do my NIH T2 fellowship, which is a very unique opportunity where NIH funds you to work on a project to submit your K grant and become a faculty. So I kind of was working towards that, and unfortunately, things just didn't work out. My mentor, which hopefully we get a chance to talk more about, but he passed away during my fellowship, and that he was the director of the division. So there was all this chaos, and my grant didn't get funded. Maybe because of that, or not just because of it. Nobody gets rarely gets grant funded these days
Right.
on the first try. So
Sure.
that's not, but that time was my like little rough period for me to decide whether I wanted to stay back as a postdoc and give it another chance with another mentor or move on. And I chose probably what you call the easier route, move on. And I moved to AbbVie. But now when you always can connect dots only backwards. So I love what I'm doing right now and where I've landed in these few years. But I won't say this is it. I I'm sure I'm still carving my path, and I'm going to open to opportunities, and I love teaching. Keep teaching at UC, PharmD students, and the master's curriculum, and I love to mentor students. So that's part of something that may take me somewhere else. We'll see.
Right. And knowing you as a friend, I know the sky's the limit for you, and I know like you haven't even reached your full potential. So I'm really, really excited to see what you're going to be up to in the future. Just one thing I wanted to comment on when you said you took the easier path and moved on. So I disagree. It's not. Sometimes moving on is really hard, especially when you have this dream of becoming a professor, and you were actually super close, right? Like you had the mentorship, you had the lab, and you started on your grant. It's just like what happened with your mentor, and we're gonna talk about later during the show tonight, hopefully. What happened with your mentor? That setback made you, like, okay, let's think about doing something else. But it's definitely like, I know it must have been hard just because I was in a position too where like I had to switch gears and I had to make a decision. And I felt guilty because like I had this vision for so long to be a professor and, have the lab and all that. I think 90% of us had this vision. And we all know, like you mentioned, it's really hard to get your grant funded from the first, sometimes second or third time. And it's very hard to find, a mentor, someone who takes you, under their wing and want to see you successful. But I love that you persisted. I love that you came up with several plans and you followed those. And I'm pretty sure like the mentorship role and the support system you have played into this, right? So like Nirmal, your husband, I guess like he followed you wherever you went. If we want to talk about that a little bit, because it's really important to have a support system, right? Especially when you're,
Absolutely.
yeah. So let's talk about that, like the role of
Yeah, but before
Nirmal
we
and,
get there, I love the use of your terminology, guilt, feeling the guilt when you
yeah.
switch your plans. I think that's a great way to put it. Yeah, go
Yeah,
ahead.
I just wanted to comment on it because I know a lot of people are,
Yeah.
they have this guilt and that holds them back from reaching their full potential and exploring other paths that, might work out way better than they thought, compared to their original plan A.
Yeah. Yeah, I mean, my Nirmal, my family, they were completely shocked when I started applying to industry because
Mhm,
I had never talked about it. But
mhm.
at some point, it was like, I want to contribute to drug development. And if I'm not able to do it here, or if it's going to take longer, let me go to industry. Let me find other ways. And it's always learning, right? You
Mhm.
keep learning wherever you in your new role. I'm sure we've talked about it during our Montana trip, how
Right.
you're learning through your current role, right? So
Right.
that's
You
what it is
expand your
about.
skill set.
Yeah.
And I mean, nothing against academia, but I see people like living in their own lab bubble. They are interacting with the same three, four people they interact with every single day, and that limits their skill set. You know what I mean? And I see a lot of potential in those people. And at some point, like what happened to you, they just, they find it really hard to take the decision to go out there and explore something else just
Mhm.
because of that guilt that holds them back.
And
But
and let's not undermine the fact that postdocs are not paid well. How long can you keep doing that in your life,
right,
right?
right.
So
The
that's true. Yeah,
uncertainty, the low pay, absolutely.
yeah,
Well,
yeah.
I'm glad that you
And
are what you
you,
are now
we
and it
both,
fits you. Yes. Yeah, I remember I was going through a rough time and I text you like, "Hey, I have an opportunity to go back to pharmacy." Um like I was doing my postdoc and I know that wasn't a good fit like for my skills and my personality, and you without any hesitation, you're like, "Try something new." So again,
absolutely.
that's the importance of support system, right? Like your
Yeah.
significant other, your friends. Um, love that. All right, moving on, Nimita. So, how did you handle the stress during grad school? I know you were under a lot of stress. It's grad school is stressful for everybody, but you were always happy for me. Like you're a happy person. You
Okay.
had a lot of
So
friends. So, yeah.
I always tell people who come in to the PhD program that choose your why.
Hmm.
It's gonna be something. You like I think you for you it was working out to take out your stress, like to get over that. For me, it was hanging out with my friends, having drinks or doing stuff. Like some days I would be out in the evening with them just because I couldn't do think or write anymore
Hmm.
and hang out, come back home at midnight sometimes. And in morning 6 o'clock I would be in the lab doing surgeries on rats. But I think that support system that you talked about, the amazing friend circle I had, including you and many others, that absolutely helped me. And I think that was the best part of my grad school life, hanging out with friends. I miss that so much.
That's awesome. That's super awesome. Yeah. And I'm glad that we talked about friends in grad school. Because a lot of people, again, like for the longest time, I lived in my own bubble, right? Like I came to Cincinnati, Ohio, which is so different from my hometown. I was adjusting. I had several hiccups. I had to switch labs and whatnot. And like I felt myself isolated, and that wasn't good. It wasn't good for my mental health or physical health. So I'm glad you were on the opposite end of the spectrum. And for everyone, like here is, someone who's successful and they still had friends and they were still socializing and going out, and they balanced it well with lab life. You don't have to spend day and night in the lab. So
Yeah, just work hard and party harder.
love it. All right, Namita. So one of my favorite questions that I love to ask to everyone is what was your motto during grad school? If you have a motto or something like a quote or something, an affirmation that you're
Well,
repeating to yourself.
I mean, it would be just keep going. I had several setbacks myself. Like first 3 years, none of the projects I was on was working. Like almost 2.5 years into my, so there were setbacks. It was very frustrating at that point. But
Yeah.
my goal was to get PhD because for me it was like there is no other thing. So if it takes 5 years, 7 years, I don't care. I need to get through this. So it's like you have other friends with you going through the same process. Um, but also at the same time, don't compare too much because there are some fields people finish within 3 years, 4 years. You
Hmm.
might take 5 years, and if you're in a more basic sciences, it could be more. So just don't compare because in the long term, that 5 years or 7 years of PhD, it really doesn't matter
Hmm.
when you think about entire lifespan. So don't stress out
Love
about
it.
time. Just keep going. Yeah.
I absolutely love it. Keep going, guys. Don't stop. I absolutely love what you just said. What was your biggest achievement in grad school, or what you consider like, yeah, I did it?
I think I got really extremely lucky with the project I worked on, and somehow the lab didn't have much funding that time, and we were trying to work out with limited resources, and we
Mhm.
just looked at this one target in brain tumor cell lines from a cancer lab, and cancer biology, and then it just worked out. Things started working out, and it was amazing. So my project was like we filed a patent on it. There's right now a clinical trial going on that drug in GBM patients at UC Cancer
Hmm.
Center. So I think it worked out really well. I was also nominated for the dissertation award. It's terrible, but I don't remember what it's called now. But
It was an award.
but yeah, it is something. So that way, it was really amazing. Like think the pro, and I think like the whole jumping around with joy moment for me was when
Hmm.
we were doing this PD experiment in rats where I was giving the drug every day, and we had done a day zero PET CT scan on it. And then when we did it on day 15, and we are looking at these scans, it was in a
Yeah.
Vaughn's lab, imaging lab, and Katie, who was working, and she shows me, and she's like, "Look, the tumor has really gone down," and I'm you're like just staring at the screen and super excited. So
Yeah.
yeah, that's still I don't think anything in my life still beats that.
I mean, it's isn't that awesome when you find like a project that's a good fit and then you generate
Yeah.
really awesome data. Like I was sitting in your dissertation and I remember like your data was like the cleanest data I've seen basically. Like, so
Right.
yeah, awesome. I'm glad that all worked out and I'm glad like, someone because a lot of people I know they worked on projects that they didn't like. Like I wasn't super fascinated with my project, but I had to get obsessed with it, in order like, to finish it and to get nice data out, but like wouldn't really be my first choice, but I get super excited when I meet people like, "Oh, I love my project." And that's actually amazing. All right, Nimita, you are super positive. I'm not sure if I should ask this question, but do you have any regrets during grad school? Something you would have done different?
You know, I actually I actually have no regrets in my life for everything that's bad and good has happened, because even the wrong decisions I've made, I've just learned from those mistakes. Plus, without those wrong decisions, I would not have landed
Mm-hmm.
to my next step. And so,
Absolutely.
I actually seriously don't have any regrets. I would still go back do all of that.
I love it. I mean, I was pretty sure you're gonna say something like this because, as I said, you're super positive. But you never know. I thought I should just ask. Okay, here's the part that I was waiting for when you talked to us about your favorite mentor or mentors and their role in your success, like on the career personal level, because as I said in my previous episode was just like mentorship can really make or break your degree, and sometimes mentors can like open doors for you beyond your PhD and beyond the job. They really help you to work yourself as a person and expand your skill set. So talk to us about your favorite mentor and how that played a role in, like getting you where you are right now.
Oh, absolutely. So, yeah, my PhD mentor was really good too. Like Dr. Desai is a great PhD mentor. But my favorite mentor and who's had the largest impact on my life is Dr. David Flockhart from IU School of Medicine. So that's where I did my NIH 32 fellowship. And so as I mentioned we talked about my PhD project that was in brain tumors, GBM, glioblastoma.
Mm-hmm.
And then I went on to do this fellowship, and my plan was I was still working in brain tumors, but in pediatric brain tumors during my fellowship. And he was my mentor, Dr. Flockhart, and guess what? He got diagnosed with GBM.
Mm-hmm.
Plus, he spent those 14 months, so right, very close to the time, like when I was submitting the Craig, and just 2 months before that, he passed away with GBM. But that time that we spent together was the most amazing time. He was a scientist, but a patient scientist, because he really literally, like, if you Google his name, you'll see his NPR interviews and things during when he was going through his treatment and everything, talking about his experience as a cancer patient.
Mm-hmm.
Because he was an MD PhD, so he used to see patients plus do research. It's his lab where they found the endoxifen, the metabolite of tamoxifen. So he's done a lot of work on that breast cancer area. So he's very well known. But that was really like an experience where I learned a lot, and I became very close to him because he used to stay by himself just a few minutes away from me. So Nirmal, my husband and I, we spent a lot of time with him. We used to have weekly dinners, and even I kind of became like his caregiver to a certain extent because his family was all far away,
Mhm.
and he was enrolled in a clinical trial in Chicago, and we used to drive there every 2 weeks. I would drive him there and bring him back, and those were the
Wow.
times we really discussed a lot about science, life, and everything.
Mhm.
And so all the things like I've learned, and maybe what you think see as a positive attitude, it's he's got a huge impact on that because he even in his last days where he was just my dad's age. So, pretty young for him to like he knew he was gonna die of this cancer, but throughout the journey, he had just such positive attitude about it. So he just kept teaching us things, till the last moment. And yeah. So even though I had done so much work in GBM, it was right. It was because of him that brain tumors GBM has become my passion.
Mhm.
And so one of the reasons I've with Black Diamond Therapeutics, like Blueprint was awesome, but I joined Black Diamond is also because they have a program in GBM. So I'm kind of moving back to that space. I really want to do something in that area.
Wow, that's an awesome story, Nimita. Thank you for sharing. Like I know the story and but I'm glad you shared it with people because, it might inspire someone to find a mentor because, a lot of people really don't understand how important is that. And, there is nothing wrong with, like spotting someone like a department chair or even a friend who's like one step ahead of you in life and something
Mm-hmm.
and asking them to take you under their wing and like teach you something, or like I had people outside of my lab that I consider mentors and I still meet with them on regular basis and they help me a lot, like not necessarily with career or like on a personal level, in career decisions. So thank you for sharing the story and sorry about Dave and but again I feel like that whole positive, I mean you're a positive person but like going through the story made you even more, like have a more positive outlook on things and more open-minded. um so if you have an advice to someone who's considering grad school, what would that advice be? And what would be your advice to someone who just graduated and maybe like looking for jobs or, having especially international students, like I know especially in this period they have like issue with sponsorship and a lot of people have to go back home and things like
Mm-hmm.
that. So what would be an advice for both like people considering grad school and people who just graduated and like they are in the face of the unknown?
Yeah, people considering grad school, I would say keep an open mind, learn other things besides doing your research, connect with people, what you said, network with people from different areas, fields, know how what everybody does, and just don't be focused on your research. That's the biggest advice I would say. And the other thing is keep going. You will eventually see light at the end of the tunnel. It will
Yes,
come.
for sure.
Yeah. So to the current graduate students or people taking in, there will be lots of moments of frustration. We all have had ours, like, but just keep going and it's totally worth it. It takes you I think the way like PhD, it's not about just becoming a faculty or getting into a job.
Mhm.
It's really about learning to think in a certain way, this critical thinking, and that's why you'll see people with PhD go in so many different ways paths.
Mhm.
Nobody like will come. You'll not see people who've done PhD in biology still doing that career 10, 20 years ago. Maybe if it was like some neuroscience related biology project, they're not doing the same work. But it's the application, it's the critical thinking, and it's like you won't realize day to day,
Mhm.
but at the end of it you'll realize how it changes you as a person. So it's totally absolutely worth it. I would love to do one more PhD if I could. So that's
Absolutely.
my advice. And I think the other thing I would say, is don't be afraid of failures. Embrace them. Retrospect, like think about what happened, what not, and introspect, and think about it, but keep moving. And I think this is the biggest thing as we come from all of us grew up in very protective environment at home. And then we are thrown into this real life scenario because before we would see no failures. And
Right.
it happens,
True.
especially in graduate schools. No experiment works the first time. And if it works, it's only beginner's luck and it will fade away soon.
Yeah, girl,
So
my stuff didn't work until like the very last year, I think. So it was frustrating. But
yeah, but so just embrace the failures, right? Like it's experiments. If you fail, don't you think what went wrong and you try to change your condition and do it? Just apply that same thing
absolutely.
to
And
loss of your life, right?
just like you said, this also changes you. Like, I don't, this may sound horrible, but one of my favorite mentors, I don't recall who really specifically, but he told me that a PhD is something that happens to you. It's not something that you do. It
Mm-hmm.
changes you, changes how you see things, like as an analytical thinker. Like right now, I am back to being a clinician, but like, you still read papers differently, you still analyze and read data and look at numbers differently. Nobody knows that, right? Like that's a very valuable skill just for your life, just for, your
Absolutely.
decisions, just like for me as a mom to decide for my kids, like data on vaccines and stuff like that and be able to, to talk to other people who are anti-vaccination or, so it's really something that affects you, affects your personality, and I believe it helps you take, I want to say, educated decisions, right? Because there are so many decisions, but not all of them are based off educated opinions. Like no offense to anyone, but really like who can read data and stats and right and draw a conclusion out of it.
And
PhDs.
and retrieve data from the right sources.
True. Yep. Exactly. Like I was talking with someone and they said, yeah, like off Scary Mommy, there's a website called Scary Mommy. I'm like, I'm not gonna no offense, it's really they have like funny stuff sometimes, but I can't take a decision, that has to do with my child based off a Scary Mommy article. Just yeah.
Yeah.
It's frustrating sometimes. But yeah, that's another thing too, that our role, like I take it upon myself to help educate people, right? And help them, like stay woke and stay informed and as much as we can, but but yeah, definitely a PhD is something that happens, like makes you a better person in so many ways. Also, all the struggles, like you said, all the failures makes you definitely more like persistent in life. So
Yeah.
yeah. All right, Namita. I know you're super busy. That's gonna be my last question to you. I'm just curious, how do you balance life? Because like I see you, like we were in Montana and you still like, you had to sign a couple of documents and I see you, I'm not on Facebook anymore, but like you always like post, like sitting outdoors with your friends or doing something. So how do you balance like your very demanding job and now your very demanding position with, having fun in life?
Well, I think the most important thing in life in general, which probably you do it when you're working and with your kids and other things, it's really to be in the moment.
Mm-hmm.
And so yeah, there are crazy days of work, and especially when you work for a biotech, you're literally working for three, four people job, covering up that much work. But it's fun. And I mean, and when I look back, I grew so much in biotech compared to big pharma just because I took that chance and I work and there are weekends sometimes. But basically the way I balance it out is just to be in the moment. As I said before, always for me, the outlet has been socializing. And, we were talking about this yellow sunshine personality where I need to socialize to
Mm-hmm.
calm down and relieve my stress. So it's very important to me. And
Yeah.
I think the other thing that, you kind of touched on is the support system. I think I have an amazing spouse. So we kind of share responsibilities, and which probably I've seen in your case as well, that
Mhm.
he also has now, works for a smaller firm as well. So we both have very demanding jobs, and it's always about give and take, right? When it's going to be crazy for me, he takes up cooking and other things to do, and sometimes I have to take over that. So it's kind of just balancing and still finding time for each other, which is basically, yeah, right. I mean, if I'm out for dinner, I'm not going to look at my work emails or worry about it. I'll
Mhm.
deal with it once I'm back or early next morning. So yeah,
Right. Live in the
live
moment.
in the moment.
Yes. Awesome. All right, Nimita. I had a great time with you. Amazing time, amazing energy. Like I wish people were with me to feel the energy. I can feel it. And really, really thank you for sharing your story and your personal stuff too. Like I really appreciate it, and I hope someone can draw inspiration out of it, and or they're listening to this story while they're in the middle of jobs or and it gives them hope. So, what would be the best way to reach Nimita if people want to connect with you or learn more about your accomplishments?
Yeah, reach. You can find me on LinkedIn,
Mhm.
Facebook, Instagram, Twitter, but I'm not as active as you are on Instagram yet. I think for any professional advice, I would say LinkedIn is the best way to
LinkedIn.
connect with me. Yes.
Hmm.
And
So,
if you put in my name, you'll find me. There's only
Nimita Dave.
one. Yeah.
Okay. Thanks, Nimita.
Yes. And
Thank you.
I'm happy to help anyone. Good luck to everyone. And you too. Thanks for inviting me.
Yeah. Thank you so much for your time. I'll make sure to put it in the show notes. So your LinkedIn is Nimita Dave, just as it's your first name and last name.
Mm-hmm.
And you have a Gmail, right?
Yes.
Nim-
So that's nimi.dave@gmail.com.
okay.
nimi.dave@gmail.com.
Gotcha. And I'll make sure to include that too in case people want to reach out for advice or anything. She's an amazing person and I know she'll get back to you guys. All right,
Yes.
Nimita, thank you so much for your time and for sharing your story. Have fun.
Bye.
Good night, and I'll see you soon.
Yeah.
All right. See
Bye-bye.
you, girl. Bye. Sid, I love Namita's story. I love Namita to pieces. Again, she is like a social butterfly. She has a mindset of steel. And I love, love, love. Her motto is to keep going because that's what she's done throughout her entire life. I watch her through personal struggles and professional struggles, and she just kept going. What do you think?
Funny story before I jump into the my takeaway from the call. So as a new student on campus back in 2012, I had heard of Nimita. I guess the Indian student group on campus at that time was pretty tightly knit. It still is, but even more so back then. I think regardless of what campuses we were on, there was still a tight knit community, and I'm pretty sure I'd heard of her name, be it here on our campus or on the medical campus. Never really had a chance to talk to her. Never really had a chance to meet her.
Mm-hmm.
So I was very curious to see what she had to say, what her journey was like. And to your point, she said, "Just keep going." And I'm like, "Yeah,
That
that
makes
hits
sense.
home. That makes absolute sense for somebody who's been through the ringer. Anybody who's in grad school right now, they're like, yeah, dude, I can so relate to that. And I guess somebody who is as accomplished as Nimita, I guess, could attest to the fact that, you know what, you just got to keep going. You got to keep trying something new. You cannot afford to be bogged down by pressure because that's just how grad school is. I mean, life hits you hard. Grad school hits you harder, I suppose. Um, and listening to her talk about her personal life, I mean, she was already an accomplished graduate student before she even moved to Cincinnati to UC, and then she had to restart her PhD, work on some cutting edge research, and then she's like, you know what? I know I wanted to be at this place, and it's okay if it doesn't happen now because eventually I'll look back. And she mentioned, you know what? I look back and I connect the dots, and this was exactly it. You know,
Mm-hmm.
it happened the way it was supposed to happen.
Right.
I guess her idea behind not being fixated on one specific thing kind of ties into our previous conversation with what Jess said. And I don't know if it's too soon to say, hey, am I seeing a pattern develop here? Be open to new things and just keep
Right.
going. Um, so I think that was my takeaway. You know what? Just keep going. It's a cliche, but it's true, and sometimes you just have to hold
Simple.
on to
Yeah.
it and
Sometimes
keep
the
going. Exactly.
solution is you guys just keep going and things will open up and you'll have choices and
Yep.
there will be rough roads, but there will be smooth ones. But yeah, sometimes, like you talk to someone like, yeah, I'm tired. Like, what, just rest, but then keep going. So
Yep.
yeah, I love it. I absolutely love it.
Yeah, too bad I missed out on a chance to talk to her when she was on campus, but I'm gonna make it a point to reach out to her and be like, hey, first off, thank
Yeah.
you for being on the call, and thank you for sharing your story, and let's be friends now, because I think she highlighted how important the feeling of community is to
Yeah.
be together
I
with
said
friends and have that support system.
we will definitely bring her back. I have no doubt she'll be back on the show because her
Absolutely.
stories are not done. In a year from now, she'll have more stories and they'll be
Oh, I
all
bet.
awesome. So, all
I
right,
bet.
you
So,
guys.
so I guess that was my takeaway, folks. Thank you so much for listening in once again,
Yeah. Thanks for
and
sticking
we
till the
hope
very
to,
end of the
yeah,
show.
absolutely. We hope to talk to you all with a new bunch of stories, a new bunch of experiences pretty soon. So until then, take
All
care.
right. Peace out, Sid. Thank you.